Hi, Mike Gibson, joined here by Bob Applegate, Michael Jaff, Roxana Mehran. Time for our wrap-up on the first day. What were some of the highlights? Roxana, what did you think?
Well, what an amazing SCAI meeting. First of all, my chair, Dr. Michael Jaff and Bob Applegate, we spent a year working together to put a program together that was very much for the clinician. And I think this morning, and this afternoon, we delivered what we wanted to do. I'm extremely pleased and just really thrilled to see so many interested interventional cardiologists, vascular medicine, and vascular therapeutic physicians here who are very, very interested in what we have to say, case-based learning. That's the name of the game.
Michael, for you.
Two hot opening talks, right? After Charlie Chambers gave his state of the affairs of the organization, to hear Christian Assad talk about how you can use social media not only to gain relationships, but also to consider changing the way you actually manage patients. He then went into discussions about virtual reality as taking Google Glass from last year and moving it, logarithms forward. I thought that was great. And then Peter Fitzgerald, I mean, how can you not love him? He always comes up with some new IT health advance thing that changes the way we all think about care. So I thought they were great.
He called it Uberization of medicine.
Yeah.
Sure, big term out there now.
Big term out there, isn't it?
So New York Times today
Yes.
has an article about Uber for healthcare, where you can actually on your phone
Get a doctor to come see you.
to your house.
Yeah.
Yeah, I think it's $90. They
Yeah.
show up within 30 to 60 minutes. They have a health aide with them, and they'll take your vitals and
Blood
examine
tests
you.
and things
Blood
like that as
tests
well.
and things. And for an additional amount of money, they'll go pick up your prescription as well.
Yeah.
So it's really changed things. That's right.
Oh, that's great.
Yeah.
Imagine you don't have to wait in a doctor's office or anything like that.
I think this is big for, say, the PCSK9 inhibitors, those injections. Who's going to want to come to their doctor's office, right? I mean,
Yeah, I
I
can
think,
imagine.
but if you had someone come to my house and inject me, or if I could go to Walgreens and get injected, that would really lower the barrier to some of these newer therapies.
Yeah.
Well, it's all about personalized medicine, right? I mean, the access, the therapies that we have to offer, and I was very interested in seeing Peter showing us his own cells that were growing, and I guess as an example of what we might be seeing in the future, where you can test your own cells against a number of potential medications, drugs, see how they interact, and really have a much firmer idea about where we're going to go.
So Mike, I think those two talks did exactly what we hoped. The room was full, people were standing in the back. They made everybody think, how's this going to impact my practice? Where should I jump on this wave? Really phenomenal.
What else was popular today? The quality tracks were very
Quality
popular.
tracks?
Oh yeah,
tell us,
we had a session. The first session of the quality track was about maintenance of certification, and we had 4 speakers who were looking at the ABIM perspective, the ACC perspective, SCAI perspective, and then Paul Tierstein was talking about an alternative way for credentialing.
Was that a packed house?
It was well attended, extremely well attended. Obviously, there's a lot of potential for some conflict in there, but very collegial. And I think it just raises a lot of question about where we're going with the way that we look at doctors. Being competent, being able to demonstrate that we're doing the right thing for the right patient at the right time. And this discussion, I think, has just really sort of amped up the conditions under which we examine all of that. So there's a lot more to be written here
But
on
I
this
think
subject.
that one of the things that I'm very much for, and I was very excited to see, is that the doctor's voice has to be heard. And I think Paul, with his move and what he's done, is basically said, all these physicians are frustrated by the ABIM's current way of certification and maintenance of certification especially. And I think that when you see that doctors can come together and have a movement that is, I thought that to me, that was very, very important. And I think there are many, many more things that we as a group of physicians can do if we all are aligned with the same
Well, I mean,
ideas.
it's actually quite a coincidence that on the day that we have the quality track, discussion about MOC, that there is a core group of leaders within SCAI, and I'm on this sort of advisory group for SCAI, responding to the ABIM and ABMS, sort of directions we need to go. And having been part of that for the past year, it really is amazing how a grassroots effort like this rose up, and I think as clearly as we've seen in the news, the ABIM is rethinking what the process ought to look like as we go into the future, and was sort of satisfying in seeing that there's some responsibility on their end that they're acknowledging, and we had a part in that.
Yeah, really an effort led by interventional cardiologists, Paul, myself, Jaff, Eric Topol, Greg Stone. We now have 2,000 people certified, and we're expanding to include other members, pediatricians and other fields, gastroenterologists. So, I think it's good to at least hold ABIM and their feet to the fire on all these issues.
Well, this is all kind of in the DNA of SCAI, right? The fact that we have a whole section of this meeting committed to quality, and we're able to talk about these things in an open, transparent forum. I know there's going to be a discussion on conflict of interest and the open payments. That's something that we need to come to grips
All
with.
mine were wrong. All my open payments were wrong. I mean,
Don't even get me started.
right.
I haven't gone there. I
You
got to
need
go
to go.
in
You
there.
need
All
to- you
physicians
need to
should
look.
go.
You
I'm
need to look.
scared. I am
you
scared.
need to go.
I've got to do that.
Yeah,
I've
I
gotta do it
got a
immediately.
letter last week that was detailing all of the things
Yeah.
that were in there.
So I
Right,
think
so-
that's the benefit of coming to a meeting like this for this society, that you can hear expert opinions about this and talk to people who are dealing with it like you were.
Right.
So, Mike, you were asking about the exciting things today, and I just wanted to mention two of the symposium that sort of kicked off as a pre-meeting, extremely well attended, Complex PCI and the VAST Symposium. And we've been particularly interested in the VAST Symposium because, we sort of popularized the radio, transradio roadshow, the TRIP programs, extremely successful. And I think the leadership of those programs was looking at, where are we with this? Have we morphed to the point where, there's enough people in the United States who are currently capable of doing radials that, we don't need these programs anymore. But and having said that, at the same time, we realize that the large bore access for the TAVRs, for the mitral clips and these other procedures is sort of re-emphasized how important it is to understand basic femoral anatomy and access, safe techniques, and at the same time figure out how to close that when you finish that. So taking these two elements together, the radial on the one hand and then the large bore access on the other, I think just underscores that today, if you're going to be a practicing interventionalist, you probably need to have both of these, in your toolbox, and they each have a little bit different skill set that you have to master. And I think it was just great this morning, the breadth of the topics. And,
I think you're going to
else.
see a resurgence of the radial access after the Matrix study. I think the Matrix study at the ACC blew everybody out of the water because there was a reduction in cardiac mortality in radial versus femoral. And so I think, with the large 8,500 patients, when you saw that, and I think people are saying, I better learn radial. And I think that the VASC meeting, vascular access meeting this morning was just standing room only, and it was fantastic. So pretty much, I tell you, we're just sitting outside of the coronary theater or the coronary tract, and it is packed in there, and even your vascular tract. And
Yep.
so this is just a fantastic. It's so exciting to see
we're
that
off.
there's so many engaged interventional cardiologists and American interventional cardiologists.
You could see the load coming off of Michael's shoulders.
No,
He was not sure, when we met last
Yeah.
year, San Diego,
2 months after
eight
ACC.
weeks after the ACC. How are we going to pull this off? And,
Thanks to you guys, we did it.
Yeah,
So
well,
we're
thanks
off
to
and
you.
running.
Yeah, it's great.
Well, I couldn't think of a better group to get things up and running. You guys are, again, the energy of you guys is unbelievable. And it's really the energy of the leadership that really drives these kinds of conferences. So congratulations.
Thank
Thank
you,
you.
Mike.
Thank you,
Thank
Mike.
you.
Great, and thanks for joining us today. And thanks to our audience out there for joining us here live from SCAI 2015.